Well, I'm delighted to have got David Ashford, Minister for Health and Social Care. It's not our usual day. Things have been tricky this week, so we'll make this a special for the weekend. Lots of things. Where do we start? Well, first of all, the news, let's get the border thing issue sorted, because this 2.5 down to 2 is causing some concern, or people don't know what's exactly happening. Have you changed things? Have you moved the goalposts since you laid out what was going to go on?
No, so it's exactly the same. Obviously, originally we were hoping to go to level 2 on the 24th of May. That won't now be happening.
Oh, so there is a movement.
That was the original plan, Paul, in the
Right.
exit framework. If you remember, the dates given was that basically 24th of May would be the move to level 2.
Yeah.
We announced the other week and brought in that we were moving to what I've termed a level 2.5. That's not an official
Very
term, that's my
techie
term.
Yeah.
Where basically we've kept the restrictions on who can come into the island the same, which is friends and family, close family, of an individual. And we've not widened that out, but we've reduced the isolation period.
Remind me, what would it have widened out to? From family and friends to what exactly?
Well, at the moment it's just family.
Yeah.
It would have widened out to
friends,
to anyone who wished to enter, basically, it would have widened out to.
But have a test.
But they would have had to have a test.
So, are you being risk averse on this one, or are you still crunching numbers with the UK?
We've got to be cautious, because we do have to remember there's no mitigations on Ireland at the moment. There is the issues around the Indian variant. Data still being compiled in relation to the India variant in the UK. So we just need to be cautious and see where we go. We've always said we'd take this step by step, and if we needed to model or change areas of our plan, we'd do so, and that's exactly what we've done.
Well, you keep your finger on the pulse on this one. Help us out on this Indian variant. I mean, yes, obviously it's getting traction, but people aren't dying. The numbers, I can't say what I'm saying like that, but there's not a critical problems as much as before because the vaccines are in place.
At the moment, there's not. I mean, one of the figures that you give me the opportunity to clear up is a lot of people have been reading the news articles and have been quoting this 33% figure with the vaccine efficacy. That's the efficacy against symptomatic disease. That doesn't mean that's the vaccine effectiveness against serious illness and death. At the moment, there isn't evidence building that the vaccine is any less effective in preventing serious illness and death. It's only less effective in preventing people developing symptoms. There's still a lot of research to be done in this area. We have to be cautious about the serious illness and death thing, though, because as we know, the data lags by about 8 days from an outbreak. So at the moment, looking at the UK figures, there isn't anything additional coming off the back of it, but we do have to be cautious and we do have to wait and see what comes through those figures.
All this sounds like, well, by putting back the 2.5 to 2 and all that, we're not going to hit this next target. I mean, should we all be prepared now to not do things like book holidays, get people over for Timmal Day, all that things that we might be doing?
At the moment, we are still on course for the end of June. We are looking at that. What we've decided to do is, because of the situation in the UK, which we do need a few weeks' worth of data, we thought dip a toe in the water, and 2.5 allows us to do that ahead of June. But at the moment, we are still working to that June date for border opening. As I've always said, it always comes with caveats. We will always try and do what's best.
I'm
for
amazed you're
the
saying that
island.
almost. I thought you'd been so careful, would be going, don't book holidays, don't do anything because of this.
Well,
everything's in the air.
Let's get the message absolutely clear. My message has been exactly the same all along. That I think unless people need to travel, they shouldn't necessarily be considering going further afield than the UK at the moment, to other countries. But we need. That's my personal message. I do need to make that absolutely clear.
How's it looking? I mean, what we're hearing about people coming in with any COVID issues at the minute. Where are we up to?
So in terms of, we had a traveller recently the other day, which is the one that came up in the figures. And other than that, at the moment, it's remaining exceptionally low, as people will see from the dashboard figures.
And that traveller, do we know which variant it is already, or is that this 8 days, 6 days, whatever you want to call it, waiting?
I don't. Public Health may at this point.
How long do they now take to find that out?
Well, we've also been working on a development in the lab, which would allow for the variant to be identified at the same time that the PCR test is done. I believe work's ongoing in that, so that will speed things up.
So, just to kind of get this in context now, you still think we're going to open the borders as it stands, even though we didn't get to 2, but you're at 2.5 because things are where they are. What makes you so confident? And you are being quite this is, you normally giving it so many caveats, but to be in that position, what data are you going on? Just purely the...
Yeah, we're going off the UK data and where the UK is, and also, of course, as we said, as we come to live with COVID, it's not necessarily about preventing any cases of COVID, because that is not realistic. COVID's going to be around forevermore, and there will always be cases, and cases will spring up. So it's about changing the mindset around protection of health and protection of life, and ensuring that as we move forward, we do so in a cautious manner. The end of June is still quite a few weeks away. If we need to vary from the plan, we will if something happens, but at the moment, with the way the UK data is...
It's all based on UK data.
And also the situation in the UK, because we also look at the risk of serious illness and death and so on, and hospitalisation rates and potentially what could happen. At the moment, we are still on the course for the end of June.